Have you ever heard of bubonic plague? You might also know it by the name of the Black Death. Bubonic plague is the most common variety of this disease, although there are three. It stems from the bacteria Yersinia pestis. Bubonic is named after the symptoms of its swollen lymph nodes that typically develop in the first week after the individual becomes infected. Yersinia pestis enters at the bite or the wound and travels through the lymphatic system to the nearest lymph node, where it replicates itself. The lymph node then becomes inflamed, tense, and painful, and is called a bubo. At advanced stages in the infection, the inflamed lymph nodes can turn into open sores filled with pus. Buboes can appear to be situated in the groin, armpit, or neck, be about the size of a chicken egg, or be tender and firm to the touch. Other symptoms of the bubonic plague include sudden onset of fever and chills, headache, fatigue or malaise, or muscle aches. This type of bacterial infection is often confused with the other two types of plague, septicemic plague and pneumonic plague. Septicemic plague occurs when bacteria multiply in the bloodstream. The third type is pneumonic plague, which affects the lungs. It's the least common of the varieties of plague, but the most dangerous because it can be spread from person to person via cough droplets. Pneumonic plague progresses rapidly and may cause respiratory failure and shock within 2 days of infection. Signs and symptoms can begin within a few hours after infection. The infectious cause of bubonic plague is the zoonotic bacteria Yersinia pestis. Yersinia pestis is a gram-negative, non-motile Coccobacillus bacteria without spores. This bacteria is transmitted to humans through the bites of fleas that have previously fed on infected animals such as rats, mice, squirrels, rabbits, or chipmunks. This bacteria can also enter your body if a break in your skin comes into contact with an infected animal's blood. Domestic cats and dogs can become infected with plague from flea bites or from eating infected rodents. The plague occurs in rural and semi-rural areas of the western United States. It is most common in the southwestern states, particularly New Mexico, Arizona, and Colorado. It occurs in areas where the bacteria are present in wild rodent populations. The risks for contracting this bacteria are generally highest in rural and semi-rural areas, including homes that provide food and shelter for various ground squirrels, chipmunks, and wood rats, or other areas where you may encounter rodents. Other risks for contracting this disease include living in endemic areas, especially in warm climates, poor sanitation and living conditions, unsettled conditions of war and relocation of refugees, people who handle infected animals, veterinarians, and people who come in contact with infected animals while hunting or camping, etc. The diagnosis of Yersinia pestis is made by taking samples from the patient, especially blood or part of a swollen lymph gland, and submitting them for laboratory testing. Detection of this disease can be done through a lateral flow assay test. This would be positive for the F1 capsular polysaccharide component in Yersinia. The final test to diagnose for this disease is the PCR test, which would be positive for the PLA protease of Yersinia. Once plague has been identified as a possible cause of the illness, appropriate treatment should begin immediately. Plague is an infectious disease caused by the bacteria Yersinia pestis, a zoonotic bacteria, usually found in small mammals and their fleas. It is transmitted between animals through fleas and then to humans. Humans can be infected through the bite of infected vector fleas, unprotected contact with infectious bodily fluids or contaminated materials, the inhalation of respiratory droplets, small particles from a patient with pneumonic plague, or the handling of infected animals. Human-to-human transmission is rare unless in the case of pneumonic plague. With prompt treatment, over 90% of people will survive. However, it is fatal if left untreated. Gentamicin and fluoroquinolones are typically first-line treatments in the United States for bubonic plague. The duration of treatment is 10 to 14 days or until 2 days after the fever subsides. Oral therapy may be substituted once the patient improves. During the incubation period, the patient can expect onset fever and chills, headache and body aches, weakness, vomiting, and nausea. With proper treatment, most symptoms will subside within 2 to 5 days. However, the individual must remain isolated until all signs of the bacterial infection are gone. There is a developed vaccine, however, it is only given to individuals